this position. And especially at this time when we're all feeling a little bit anxious because of what's going on in the world around us, and about you might be anxious about your job or about your family or about healthcare issues. That shallow breathing isn't going to help with that. It'll only make you feel more anxious. So nice deep breathing is essential to maintaining a nice calm demeanor and a positive attitude. Your head is another problem. And I don't mean, what I mean is that your head is heavy, okay? So an average head weighs about 4.5 to 5.5 kilos. So that's kind of 10 to 12 pounds of weight. That's the weight of a light bowling ball. Now, if you could hold a bowling ball up on top of your shoulders here, you could probably hold it for ages because you've got a pillar of support underneath it. But try holding a bowling ball out here. How long will you last? Not very long, because the laws of gravity pull it down. And the same thing is happening with your head when you're in slump posture. Your body feels it as a 5 kilogram weight when it's up on top of the head like that. And the muscles can cope quite readily with that. But as soon as it hangs forward, your body feels it as a lot heavier than 5 kilograms, and the muscles will not like you for that. So there's the problem, okay? We've got poor posture, we've got how that poor posture affects our breathing, how it affects our muscles, how it affects our joints, and all those things can affect our overall attitude, mental attitude, and physical demeanour. So we're going to look at briefly now, what is good posture? How can you correct that? Many of us know that sitting upright is better than slumping forward, and that's a good start. But we're going to work from the ground up here and just show you what's a good posture for working at a desk. So I'm going to be able to have to explain some of this because you can't see it all in shot, but you'll understand what I'm trying to get at. So I'm going to move a little bit further away. So sat in a chair, I'm sat at my kitchen table at the moment, at the dining room table. You might have a desk at home, which would be great, but if you're not, if you're like many people, you're probably working from a table that wasn't designed to be a desk. So you're also probably sat in a chair that maybe isn't designed to be sat in for long periods of time. So you need to get that right too. So I'm sat in a normal dining room chair, and that's much better than a soft chair. So I just want to introduce a few do nots in this part of it. So working in a soft chair or in your bed or on a sofa or having the laptop on a low coffee table are all big no-nos, okay? They might feel comfortable temporarily, but your body is not going to thank you for it after a little while. So do not work in any of those positions, not in bed, not on a low chair or a comfy sofa or a comfy armchair, and definitely not with the laptop down on a coffee table, okay? So here I'm sat at my table. I've got a dining room chair here as well. I want to be sat back in the chair, so not slumped forward, okay? I want to be sat back in the chair. My legs aren't crossed, my feet are flat on the floor. Now, it's important to get your posture in your low back right, and there's going to be a little bit more about low back exercises and things you can do to help your low back a bit later on in the webinar, so stay tuned for that. But just briefly, I'm going to talk about getting the right posture in your low back for starters, because if you don't get this right, anything you do from here up is not going to work properly. So I want you to sit on a chair for a moment, and I want you to sit forward on the chair a little bit. So don't sit right back in it, sit forward, and I want you to just allow yourself to slump forward like that, okay? So slump forward, allowing your low back to kind of go backwards in the chair, right? That's your first nasty posture, okay? So that's the slump posture. Now what I want you to do is I want you to sit nice and upright and push your belly forward as far as you can, and that creates a rather uncomfortable arch in your low back, okay? So if you push it forward as far as you comfortably can, but that starts to get uncomfortable in the back as well. So that's your second unnatural posture. Those are the two extremes, the slump and the extreme the other way. Now where your spine likes to be positioned is halfway in between those 2 points. So halfway between the slump and the forward is that middle position where you're likely to feel more comfortable, okay? That's what we call a pelvic neutral, spinal neutral position. Now when you're feeling that now's the time to sit back in your chair, okay? And therefore your back will be nicely supported with that nice neutral position in the low back. So that's important to get right, because if you don't get that right, it's difficult to do things from there up. It's also important that you bring your chair in so that you are sat up against the table too. If you have your chair back and you're leaning forward on the table, you're encouraging from the word go that slump posture, okay? So one thing I always say to my patients is don't allow yourself to rest your elbows on the table. You're asking for trouble, okay? Because it will encourage this kind of posture. You're going to end up slumped forward like this. So bring the chair in so that you're right up against the table like that. Elbows off the table. So make sure that you haven't got any arms on your chair, which will stop you from getting underneath your desk or table, okay? That's really important. You need to be able to put the chair underneath and sit underneath that table, okay? So we're here now, we're nice upright, we've got shoulders relaxed, we're in a neutral position, pelvic neutral position with our low back. We're sat up against the desk, we haven't got our elbows on the desk. What about our computer? Well, in the ideal world, you may be able to get hold of one of these, okay? Now, this is a laptop stand. I just got this off of Amazon. There are still ones available on Amazon. I checked this morning, there are many different ones you can buy. So this has two benefits. Firstly, it brings your computer up so that the monitor is at eye level or near enough. The second thing it will do is it will also create a cool space underneath the laptop so the laptop doesn't get too hot, okay? So that's what we want ideally, is a laptop stand. Now you can see from there that that brings the monitor much higher than it would be normally. What we don't want to see is with a laptop down here, you're going to be staring down at your screen like this, and you will not be able to maintain a good upper body posture with that. So get that laptop up on a stand. If you don't have a stand like me, then the alternative is to get a couple of big books. Okay, so I've got a couple of big reference books there, and I can pop that on there instead, and that creates pretty much the same kind of thing. All right, so that's number one. Get your laptop up higher so that the monitor is as close to eye level as you can reasonably get it. Now, one problem with that is that the keyboard is now up here, so you can't work like that. You can very cheaply and easily buy what's called a USB keyboard now. So these are they're usually Bluetooth, or they plug into the USB on your computer. They're not expensive, you can get them quite cheaply, and that will connect to your computer so that you can now have your monitor at this level, and you've got your keyboard down here again, so you can work at this level here. And the same thing applies to a mouse. You can also get Bluetooth mouse or a USB mouse that will do the same job. So that's really important to get those set up, because if your laptop is down low, you're going to find it very difficult to maintain that good posture. Okay? So laptop up high, USB keyboard if you can. If you haven't got one now, it takes just a day or two. If you've got Amazon Prime or something, or some other online order service, you can order one and it'll be with you in a couple of days. The next thing is to remember to bring things to you, as we've said. So you're up against the desk. Also, don't have things too far away. If you have to lean for a mouse, or you have to reach for something, or reach for the keyboard, you're going to find it very difficult to maintain that upright posture. So don't go to your stuff, bring your stuff to you, and that allows you to maintain this nice upright posture, which will keep you and your back and your neck and your muscles feeling much happier. The other thing to remember is that it's really important to take regular breaks. Now, we all know this, but once we get engrossed in a piece of work, or we've got something that we need to finish, it can be easy to forget. We might find that we've been on the computer for an hour and we're starting to get pain in our neck. So it's a good idea to set a timer, some kind of like an egg timer, or a timer on your phone is probably the most convenient thing. Something that will go off every 20 to 25 minutes that will just remind you that it's time to take a break. And don't ignore that timer, because it can be easy if you're in the middle of something just to say, oh, I'll be fine, I'll carry on for another few minutes, and before you know it, another hour's gone by. Obey the timer, okay? Take a break every 20 to 25 minutes. And the third thing we're going to look at now, after having looked at what the problem is, we've looked at how you can set your laptop up at home to get that good posture. We've learned how to sit properly, how to have a nice upright posture, get that head up, resting on top of your shoulders, balanced in that position. Remember, the further it hangs forward, the heavier the bowling ball gets. We're now just going to look at a few alleviating exercises and stretches that you can do that just take a minute or two. Okay, so it's not going to take up a lot of your day, but it will make a big difference to your day and a big difference to your muscles and lessen your headaches and things like that. Remember this, even with the best posture in the world, so you might obey all this advice, if you sit at your computer for 3 hours, 4 hours, all day, whatever it might be, you're going to be in pain. You're going to get some problems. So even with the best posture, you're still going to need to take these breaks, and we call them little micro breaks, really. And there are a few things you can do. So I want to just teach you one little position, which is a really good one to do. So I'm going to move back a little bit so you can see me a bit better. And hopefully you can still hear me. So we call this a Ruger relief position. So you need to sit on your chair, just sit forward on the chair a little bit like that. And then what you do is you sit nice and upright and you bring your arms out to the side like that and turn your palms up, okay, like that. So turn your palms up and kind of, this is to really open the chest up here, to stretch these pectoral muscles out, open it up, and then take a series of really nice deep breaths, okay? So nice deep breath in, just hold it for a few seconds, and then out again, okay? Stretching all the muscles here, turning those hands up, okay? And that just really stretches everything out here. And do that 3 or 4 times, okay? So it's forward on the chair a little bit, just sit nice and upright, just stretch, bring the shoulders back a little bit, turn those arms out and hands facing towards the ceiling. And a nice deep breath in and out, and just do that a few times, okay? So that's a nice little micro break that you can take. And that really helps, and you'll instantly feel, even when you do go back to your computer, you'll just feel a little bit looser and a bit more open through this upper body area at the front. And the next thing I want to teach you is a few stretches, okay? So it's really important to stop those muscles from getting too tight when we're working at home, and to increase or maintain the normal range of movement that you've got in your neck, right? So let's have a look now at some simple stretches. Number 1, I want you to sit nice and upright, interlace your fingers together like that, and then nodding your head forward. So we're not talking about pulling your head or neck forward, we're talking about nodding the head forward. So basically just bring your chin to your chest, like that. And then put the hands behind the head and just gently stretch the head forward, like that. Let the weight of your arms do the stretch, don't pull, okay? So just let the weight of your arms stretch forward, nice upright posture, put the head nodded forward, and you're just stretching out. And you should feel a fairly comfortable, but an intense stretch in the back of your neck there. Now, obviously, as we said at the beginning there, if this is painful for any reason, or if you've been told by your chiropractor before you've got any worries about this, do check with your chiropractor and don't do anything that feels painful or hurts you. But you know what the difference between that kind of unnatural pain and the pain that you'd feel on a stretch of a muscle. So that's number 1. Number 2 is this time you need to be on a chair for this, and I want you to reach underneath the chair with one arm and hold on to the underneath of the chair with that hand, okay? And then bring your opposite ear down to your shoulder like that, okay? And that stretches out down through here, and you can intensify that stretch just a little bit by bringing your hand up to the side and just leaning away from this other side. So this side here is anchored down, and I can lean away from it and my shoulder won't move up. If you haven't got your hand underneath the chair, all you're going to do is just kind of pull yourself this way. So anchoring the hand here, you're just going to lean across like that, and that gives a really good stretch down through this upper trapezius muscle, okay? You can also do that obviously on both sides, and I encourage you never to do a stretch just on one side unless you've been told to just do it on one side. So do those on both sides. And you can incorporate a similar stretch, but kind of a mixture between the two now, of anchoring underneath the chair again, but this time turning your head to about 45 degrees. So imagine if you were sat in the middle of the room, look to the corner of the room, and this time just nod your chin to your chest again and bring your head down like that. Okay, and that stretches the muscles just behind the neck a little bit, a different muscle, the one that attaches onto the top of your shoulder blade. One last little stretch that is really nice to do is also to put your hands, again, interlace your fingers, put behind your neck like that, and then try and squeeze your shoulder blades together. Okay, so you're bringing the elbows back like this, and imagine that there's a pencil in between your shoulder blades that you're trying to pinch, okay? And it just try and pinch your shoulder blades together a little bit like that. Hold it for just a few seconds, maybe 10 seconds or so, and let go, relax, and maybe repeat that 2 or 3 times. So we've dealt with the problem, we've dealt with how to set up your workstation to minimize the amount of pain that you have when you're working at home. Remember, even with the best posture, if you stay there for hours, you're going to have problems. So take micro breaks, include some range of movement exercises, get up, do something else, even if it's go to the loo, go make yourself a cup of tea, get up and have a little walk around. It only takes a couple of minutes. Do these stretching exercises and little micro breaks, and that will stop, hopefully, these muscles from getting too tight during the course of your working day. If you want any reminders of any of these exercises, then we can provide that for you. So just let us know, and we can probably send you a link to a video via email that you can watch on your own at home. And remember, at the end of your working day, don't go from your laptop to your phone. So it's all too easy to go from our working day and then in the evening spend half your evening on the phone, checking Facebook, checking tweets, looking at the news or watching Netflix or something on an iPad. So just be wary that your body's going to need a break from screens at the end of your working day. So don't go from your laptop straight to your phone and do that kind of thing. So another useful tip is to have a finish time. So when we're working from home, it's all too tempting to have the computer there all the time and keep going back to it. Have a finish time and just say, look, that's all I'm going to do today, and that's enough for today until tomorrow. So hopefully these tips have been of help to you. Like I said, if you need to know any more or you want to ask any questions, please ask the questions in the chat. If we can't answer them now or we need to answer them in more detail, then we'll do that later, and we can send you some video clips to some of those exercises should you need them. But thanks for watching, and I hope that's been of help.
Thank you, Andrew. That was great. I've got to do some work on my workstation here, I think. So as Andrew said, if you need reminders of any of that information, I will have the email address on the screen at the end, but do either put something in the chat or drop us an email later. So now we're going to move on to Sian, and Sian Davies-Todd's going to help us to keep our neck and back moving. Sian, please.
Thank you. Good. I was muted. You had me muted. So mine follows on really well from Andrew's, and Andrew's presentation was brilliant, and he should have his own YouTube channel and spread the word. So my talk and presentation is about what to do if you didn't follow Andrew's advice, or something else happened, you fell asleep on the settee. Heaven forbid we should ever do that. You stayed in bed too long, or you've been given the opportunity to do a lot more gardening because you're on furlough, or you can't go out, and you spent a lot of time bent over, and you suddenly realise your neck or your back is very, very stiff. This couple of things I'm going to show you are for acute stiffness. So like you fell asleep on the settee and you get that, oh no, what do I do? This is what to do. But you can also use these mobilizations, which is what they're called, for just any time. So actually Andrew spoke about the computer use. So we're looking into the computer all the time, and humans are very, very forward facing. We're very much visual animals, and we are animals. That's the other point. So we tend to want to look forward all the time, tend to look down a lot, and we don't really move very much, but we're animals and we should move, and we should be moving our neck and our low back and all this. So these are the most simple exercises you could possibly have for acute stiffness, but for any time, and helping to either get you out of a bad place where you've suddenly got acute stiffness, or just helping you generally keep really mobile and loose. If you've had neck surgery, fusion, it's not that you can't do these exercises, but you just probably haven't got the range of motion that you would have. So you never push, you only go as far in the movement as you can go. As Ray said at the beginning, if there's any sharp pain, sudden pain, don't do it. And if you have recently developed really painful condition, then this probably isn't going to be the thing you want to do. This is for things you would recognise as stiffness, severe stiffness maybe, but stiffness. And the reason we would do these movements, these mobilisations, is to stop you then injuring yourself. So if I fell asleep on the settee, heaven forbid, or in my armchair, and I woke up like that, if I suddenly whip my head round, I'm quite likely to cause tiny tears in the muscles and parts of the joints, and therefore get acute pain and inflammation. So we do need to think a bit about moving. I won't show you any movements that could affect you if you've got neck conditions. If you also have high blood pressure and it's uncontrolled, probably you shouldn't do these. And if you have labyrinthitis, vertigo or dizziness, you will know that neck movements can be a real nuisance, so probably you shouldn't do them either. But be a judge of your own body's needs. Okay, so Andrew gave you the posture to sit in. Mine's a little bit different, so I'm going to sit forward on my chair. You probably can't see, but I'm sitting forward on my chair and my feet flat on the floor. I have to come forward because I have got normal length legs, so I have to come forward a bit so that my feet are flat on the floor. My knee is making a 90-degree shape there, the bend of the knee. I'm sitting upright on my bottom bones, so as if you're alertly waiting outside to go in for an interview somewhere and you want to look professional and on it. And as Andrew said, your head is right on the top there, so we're not doing this, we're not back. And then I want you, I'm just going to turn sideways to show you that it's a tiny movement. I want to set the muscles in my neck so that I'm safe to do the movements. So I'm going to put my head on top of my shoulders and just very slightly draw my chin in. It's almost nothing, but it just sets the muscles. And it's not so far that I can't speak, but my chin isn't forward and up, my chin isn't down, it's kind of there, and it should be parallel with the floor, and you can get someone to look at you, or you can look in the mirror. So I retract my chin slightly in like that before I start the movement, okay? And you shouldn't feel any tension. It's really quite a relaxed retraction, if that makes sense. I hope it does. And shoulders are down. In fact, if you want to, you can sort of give them a little shake before we start. So then, all I'm going to do is turn my head, but bear in mind that I'm really supported with my feet on the floor. I'm really supported through my bottom bones. I've got that slight retraction of the chin, and I just turn my head. I'm going to go as far as I can comfortably go, and I can hear cracking and clicking. It doesn't bother me, it's not a problem, we will get that. Actually, because I've been practicing this for this presentation, I'm getting less cracking and clicking. So notice I went through the middle, so I might go to one side, doesn't matter which side, and then I'll come back, but I won't stop in the middle, I'll carry on. I'm doing it nice and slowly. So remember, this is useful for acute stiffness. I don't want to be rushing at it. So never feel you haven't got the time. You've got the time to look after your body. So I would do that nice and slowly, several times. And then I'm going to, and you don't have to do this, it depends on where your stiffness is located, but for general mobilization, I would do all three movements I'm going to show you. The next one is side bend. So ear to shoulder. Again, I retract the chin slightly, bend the head. Now, I'm very aware that my right shoulder wants to come up, so I'm going to make sure it's dropped down. There's something about us that when we hear the phrase ear to shoulder, our body goes, oh, shoulder to ear, but it's not that at all. It's ear to shoulder. And this is quite a powerful movement, actually. This isn't one we do a lot of. We tend to do more rotation, but even not enough of that, really. We tend to be stuck in this position. So that would be your rotation. Do that a few times. I didn't retract my chin. Retract your chin. My lateral flexion, so side bending, keep the shoulders down. And then the last one is just a slow nod. So Andrew showed you the stretch with the chin down, coming down onto the chest. So this is just a slow nod. Think of your head as a big ball rolling down a hill. Let your eyes follow the movement. Don't bend your back and roll the ball back up the hill. Do not tip your head back, okay? Avoid extension, that's extension, just because you can do some damage there. And I don't know who's out there, and it may be that is not suitable for you. So really I avoid extension most of the time. I should have said at the very beginning, when you've got your feet on the floor, nice and flat, and you're feeling strong there, like Andrew said, I want you to do some deep breathing first. So just breathing in through the nose, out through the mouth if you can, or in through the nose, out through the nose, doesn't matter. And just become aware of the neck, how it's sitting on your head. Become aware of your breathing, become aware of your body, feel the strength through your feet and through your bottom bones. Just center yourself and just give yourself some time to let everything go as well. So we find in this difficult time, I certainly have been a lot more anxious, a lot more tense. And when we're like that, our neck tenses, our shoulders come up, we sleep tensely, we get stiffness, we tend to drink half a bottle of champagne or whatever and fall asleep on the settee, not speaking personally. So just give yourself time to breathe and be aware before you start the exercise. So that could not be simpler, okay? I will move on to low back now, so low back mobilization, and this is really quite personal for me. So I've been doing a lot of moving plants about, taking plants, had to take a huge massive thing out of the pond that I'd stupidly let grow, and when I've come up from my bending position, I thought, whoa, this is really stiff. So again, the simplest thing in the world. This is also a great one to do first thing in the morning. If you wake up in the morning and your back is stiff, or any time, as I say, this is so easy. It mobilizes the back and hips. It warms you up a bit. It gets you ready for the day. So I'm just going to move my camera around so I can go and stand. Hope this works. Ah, good. Okay. So I'm going to hold on to a surface. I'm going to assume that pelvic neutral position, but standing. So my coccyx points towards the floor, more or less, my bottom bone, and contract here. So as if you're trying to squash your bladder. It's between the pubic bone and the navel. Try and just pull that in, and you'll find if you're doing it correctly, your buttocks will contract. These are big muscles. We want to use them to help us lift our legs. So assume the position. Feet are sort of just shoulder width, no more. Doesn't really matter hugely. So I'm contracting the buttocks, dropping my coccyx towards the floor. I'm just going to tighten the buttocks a bit and lift the leg, and then the other leg. So this is going through a cycle of repeated motion, as slowly as you like. I can hear some clicking as well from hip ligaments, don't worry about it. Keep this contracted as best you can. Keep the buttock contracted at the bottom. Pun not intended. Ooh, cracking noises. And this I in the garden yesterday, because I've been preparing for this session, I stopped, got off my big fork, and did these. And actually you could lean on your fork, lean on the fence, lean on the shed, lean on a wall, but supporting yourself. Because when your back's stiff like this, I would not recommend that you do it sort of free form. You're putting too much stress there on a compromised back. So we just do this. How long do you do it? How long is a piece of string? You do it until you feel a bit of warmth, perhaps until you feel more mobile, and you can then stand up, walk around, check it out. An additional variation is to bring the leg across if you want, So we're getting a bit of stretch, a little bit more through the low back, a little bit of stretch. Okay. So couldn't be simpler, couldn't be easier really. And the last thing to add in, depending how you're feeling, is a hip and low back mobilization. I don't know what you would call it. It's a rotation of the pelvis. So circles. You just do circles as small as you like. So you do. They don't need to be big. This is the thing about all these exercises, mobilizations. They're what you can do. They're within your normal range of motion. It's not a competition. And I would go one way, and I would go the other way. And that is really helpful. So kind of push the hips forward at the back, push the bottom back. Sorry, at the front. As you come forward, lift the pubic bone, and then the other way. I found this hugely helpful. But the trick is getting yourself in the discipline to do it, I think. And that's where I lack, is rushing from one thing to another. Even now in lockdown, I seem to have an awful lot to do, certainly in the garden. So it's, oh, I'll do this, I'll do that. I'm really, really going to try and remember to do these mobilizations. They're just so good and helpful. And as I say, simple, no equipment needed. You do what you can within your own range of motion. I'm going to sit back down. There we go. I think. Yes. Okay. Hang on. Right. Yes, so to say, if you have, like Andrew said, if you have some discomfort, and you may have, I certainly feel in my neck when I turn it, some discomfort, judge whether that is, bad pain or good pain, and you may feel some discomfort. I certainly do in the left side of my neck, where I need Andrew to adjust me, and I hope we can do that soon, who knows. The other thing to say is, I did say if you have dizziness, vertigo, or labyrinthitis, this isn't one for you. But you, if you possibly can, will hugely benefit, as we all will and do, from just walking. So a decent walk every day moves everything. It moves your neck, it moves your shoulders, it moves your spine, it moves your hips. It just moves everything. And getting outside is probably the absolutely best thing we can do at the moment. And you could do your exercises outside as well. We're having lovely weather at the moment, so do take advantage of that, to do walking, to keep moving, and turn your head if you can, especially if you're sat at home and you're used to looking at screens, or working from home, working in an office. Really remember, it's so important to keep moving. That's it from me. Thank you.
Thank you, Sian. That was really good. You've shown us some easy exercises, I hope. And as we've said, if you want to have any more information, please get in touch, leave us a note in the chat, or drop us an email, and then we can get those exercises out to you. Now, I know we didn't manage to get the resistance band out to all of you in time, but it is on its way in the post. So in the meantime, we have Erika Anderson, who's going to show us resistance band exercises and some others that we can do at home. Thank you, Erika.
There we go. Okay, so lower back pain is often due to an imbalance of the muscles of either the lower back or the pelvis. So when I talk about the lower back or the lumbar spine, if I show you on my spine, I'm talking about these lower vertebrae right at the bottom of your back. And then the pelvis is made up of these bones here. So you've got the sacrum, and then you've got the two ilium either side, and they're the pelvic muscles. So the pelvic joint. So the muscles can become tight or weak and not support those bony structures. So the chiropractors will adjust those bony structures, but there's lots of things that you can do at home to help yourself. Normally during a course of chiropractic, we'll prescribe you some exercises that you can do at home. And it's really important to do these because they prevent back pain and keep you mobile and keep you functional and prevent future pain. So due to this pandemic, I'm sure your lifestyle has changed somewhat. You're probably sitting down more, as both Sian and Andrew have mentioned, watching TV or working from home, or maybe you've been doing strenuous activity like gardening or DIY. But I think it's safe to say that most of us have been sitting down or being immobile for long periods and then having bursts of strenuous activity. And all of that is going to affect your lower back. So, too much sitting. We aren't designed to be sitting all day. And when we sit too long, if I go back to this, and hopefully you can visualize what I'm describing a bit better. The pelvic muscles are supported by your glutes, in particular glute med. And glute med lies along the top of this bone and attaches to the sacrum. So each side acts like a girdle. And when we're sat too long, this muscle becomes stretched. And when it's stretched, it just switches off. So I'm going to show you an exercise that will switch it back on and tighten up those pelvic joints. And the other exercise I'm going to show you is for a core muscle, back to the spine. This muscle is called the psoas, and it's a lumbar stabilizer. It's a really important muscle because it's a lumbar stabilizer and it's also a hip flexor. So when we're sat down with our hips flexed for long periods, this muscle becomes shortened and weak. So I'm going to show you an exercise for that. That's called dead bug. And now it is possible to have an overstretched psoas as well. It's a bit less common, but when it is overstretched, that will affect our posture, the way we stand, the way we walk, and will possibly cause pain or discomfort in the front of the hip. But your chiropractor will be able to diagnose you with that and give you some exercises to help with that. So, but most people, the core is weak. So that's why I thought we'd focus on a core exercise today. So before I get down on the floor, I just want to say, just like Sian has said, just like Andrew said, if you try an exercise that I show you now later on and it's causing you unusual or sharp pain, or you're a bit worried, then just don't do it. Stop. You can speak to one of us, and you know we'll be able to help you with that. So the first thing I'm going to show you is a movement to warm up first. So before you do an exercise, it's always important to warm yourself up, and this is a great it's a warm up, but it's also a lumbar mobilization, like what Sian was showing you. But it's nice and easy. So I hope you can all see me properly. So you're going to get into what's called the table position. So you're on your hands and knees on the floor. So get your spine neutral. So back nice and flat. Your hands are going to be underneath your shoulders. Shins flat to the floor and the knees underneath the hips. So this is your spine neutral. The first thing you should do is bring your upper back towards the ceiling. So you'll try and think of your individual vertebrae moving as you raise your back up to the ceiling. You're tucking the pelvis under and you're lowering the head, and you're just going to relax into this position for 5-7 seconds. So really think about what you're doing and press into the floor. Keep your tummy tucked in all of the time. Now you're going to turn the pelvis up, bring back to neutral, keep the head relaxed. Now you're going to turn the sit bones up and get some what we call thoracic extension. So you're going to bring your chest down and look straight ahead of you. So it's important not to lift up too much in the neck. Just keep your head at neutral at the ceiling here. And then you're going to repeat that. So sit bone under, bring the upper back up to the ceiling, really feel that stretch between the shoulder blades, keep your tummy tucked in, and then back again, slowly back to neutral. I didn't mention breathing. You want to breathe deeply with each exercise. So I'm going to inhale as I come in, keep my tummy in, but turning the pelvis up, and looking at pelvic neutral. So you want to do a few repetitions of those, just to warm up the spine and get everything moving. Right, so now I'm going to show you some of those exercises that I was talking about. You don't have to use a resistance band, or a TheraBand is what this is called, but you can, because it makes it harder. TheraBands are excellent because they allow you to really focus on the muscle group that you want to work on. So when you get your band, it will come in a long sort of belt, and I've just tied mine really firmly in the middle, and that's not going anywhere. So that's really nice and stretchy and strong. So let's get on the floor. This first one is called dead bug. So I'll show you without the band first. So hopefully you can see all of me. So you're going to get back into this table position with your shins parallel to the ceiling and your arms up to the ceiling as well, keeping your tummy in. And coordination is key with this one. So now I'm going to move my left hand and my right foot away from the midline and towards either wall, but nice and slowly, like so. And then bring it back up, and then do the other side. So really slow, controlled movement, but at all times you must keep this core engaged. Keep that going. Now, if you have your band, you can do it with the band as well. So you wrap one end around one foot and the other end from the opposite hand, back on the floor, same position, but this time we're just going to focus on one direction of movement. So I'm going to pull back with my right hand as I push away with my left foot, like so. So if you're going to do it with a TheraBand or a resistance band, you probably want to do 6 on one side, then swap feet and hands and do 6 on the other side too. But if you're going to do it without a band, you can just alternate, maybe just do 12. So with exercises, I tend to prescribe 3 sets of 12, if that's not too much, but just work up to your tolerance. So remember I talked about those glute muscles, which are the pelvic girdle? We'll do a glute exercise now, and this one's called the clam. It's so easy, but it's also easy to get wrong. So you're going to be in a side lying position. Either you can prop yourself up on your elbow, or you can prop your head up. It doesn't really make any difference, whatever's comfortable for you. Keeping your feet together, look down at your knees and make sure that your knees are stacked one on top of another, because if your knees are level, that likely means that your hips are sort of perpendicular to the ceiling or to the floor. And that's really important for this exercise. So I'm going to keep my feet together, keep my tummy in, and I'm going to raise my knee, contracting this muscle at the back. Probably doesn't have to be very much, 6 inches is plenty, and back down. So you notice that I'm not rocking back as I lift my knee, because that's not working your glutes. You have to keep the hip straight. And actually, if you were to put your hands on your hip here, like I'm doing, where your thumb is, you might be able to feel the contraction of that muscle underneath the thumb. And you just do those small movements. And as Andrew said earlier, we always do both sides. And I would, try 12 and see how you feel. Now, if you have your band and you want to make it a little bit harder, you've tied it in a big loop here, you can double it over, so you have a double loop, hook it around your feet, bring it up to the knees, and you can do it with the band. It will just add a bit of extra resistance. Right, it's easy peasy. There's so many exercises that you can do with these resistance bands. So if you want to, we can offer you an assessment, an online assessment, and tailor some exercises specifically for you that you can use with your band. But I want to end with some stretches. So, as I said earlier, we can get lower back tightness. So it's important that we stretch out the muscles right at the back. So either you can sit with your legs crossed like this, or you can sit with your feet out. I'll move back a bit so you can see. So keeping your tummy in, as you always do, you're going to put your hand on top of your thigh. I'm going to be stretching this side. You're going to bring your arm up and over. And just breathe here, 30 seconds. Try and make sure that you keep this hip down. Don't bring it up, and then you'll get a deeper stretch. And obviously you do both sides. So that's your lower back stretch. That's quite nice. And I'm going to show you a glute stretch as well. Now this stretch is brilliant because it not only stretches your glute, the one we were working on with the clam, but it also releases a bit of lower back tension too. So you want to get a chair, sit on your chair. So I'm going to be stretching this side. Sorry you can't see my face, but I thought it's more important that you see this bit. So I'm going to bring this leg up, put it on this knee, keeping my tummy in. I'm going to take a deep breath, and then I'm going to hinge forward from the hip. Now I feel that stretch right in the glute here. If I turn my chair to the side, I can show you what it's important not to do. So same leg again, tummy's in, foot flat on the ground. Don't press down on the knee. I see people do that all the time. It's really not good. Just relax your hands onto your thighs. So it's important not to bend forward with your back, but you're actually going to hinge forward from here. So you see my back is straight, and I feel a nice deep stretch in the glute. Right, so I hope that's been helpful. If you have any questions, just message us at the end. And remember, we can always prescribe you exercises specifically for you if you would like. Hope that's been helpful.
Erika, that was fantastic. Thank you ever so much. I'm sorry that we didn't all get our resistance band in time, but it is in the post. So hopefully soon you'll be able to do all those things at home by yourself. But like Erika said, like all the chiropractors have said, if you need some advice, you want something specific to your condition, please get in touch and we'll be happy to send you something to help you out at home while things are difficult. So our last presentation today is with Jenny Casemore, who's going to tell us about trigger point therapy. What is it and how can it help? Jenny.
Well, I'm here at last. It took me a long time to join, lots of technology problems, but here I am. So that's a hard act to follow. Great exercises for America, brilliant. So this lockdown, it's really strange, isn't it? But I'm trying to look on the positive side of being in lockdown. It's given us time to be at home without distractions. We don't even really to have to go out and get food. We can have it delivered to us. So what are we doing at home instead? Well, some of us are actually working at desks and things, and that's been great advice from both Sian and Andrew about that. But I've been decorating, joining thousands who've been decorating. I think there's no more paint in the shops now. So I've been rolling the walls, so arm up, arm down, arm up, arm down, then cutting in, I think they call it at the top, where you try and make that amazing line and you spend hours with your hand up overhead. So guess what? I've got sore shoulders. But other people have been out in the garden. They might have been digging for a plot for vegetables, or cutting that lawn, or pulling out weeds. You have to be careful with that. Or maybe they've been inactive and relaxing. I think everybody's mentioned the sitting around a lot and binge watching on Netflix. You know, I'm guilty of that as well. So all of this has an effect on our muscles, and our muscles tend to become rather tight and tense and sore. In addition to that, there's all the worry, isn't there? You know, we're worried about our family, our friends. We're worried about the economy, both in this country and in the world as a whole. And all this worry produces tension in the muscles. It's called a psychosomatic reflex. So, muscular pain, what causes it? It could be a simple strain or bruise. And, you know, we heard from Andrew about how poor posture at a desk can strain particularly the muscles of your neck and shoulders. And then if you've been out doing your bit of exercise, that one exercise a day that we're given, and you haven't stretched after, if you did something like running or cycling, then you may have tense and tight muscles from that. So in all tight muscles, you usually find a taut band. And in that taut band are trigger points, or to give them their long name, myofascial trigger points. So I think we've got a screen to share now. Aha. So here we see 14 major trigger points. So it gives the area and the name of the muscle. So, like for example, in the suboccipital muscles at the base of the skull, you can see the red points there. So those are the trigger points, and in fact, also a pain point as well. So what are trigger points? Well, they're little discrete, painful nodules. They're very small, might only be a couple of millimeters, and they can be painful in that area and also refer pain to another area. That's called an active trigger point. If we find a nodule, if we were palpating somebody in the clinic, it may not be actively painful, but if we put pressure on it, then it will cause the same pain, and that's called a latent trigger point. So research has been fairly limited on trigger points, and that's because they don't really show up on diagnostic imaging. Can't see them on X-rays, MRI scans, or CT scans, but they have been there's been more research recently using electromyography and high quality ultrasound. And recently I heard that there's some research being done where they have actually photographed them, and that's about to be published, so that's exciting. So where are they found? Well, obviously in the muscles, as you can see by the pictures, but only in what we call skeletal muscles. So that's any muscle in the body except for the muscle of the heart or the muscles in the walls of the blood vessels and the gut. And what causes them, these trigger points? Well, probably sudden acute overuse, particularly if the muscles are already tight, chronic or repetitive overuse. For example, maybe at work when typing for hours, and this can lead to tension in the neck or the shoulders. So injuries to joints, both spinal and peripheral joints and the tendons, and that can cause protective muscle spasms and taut bands and trigger point development. And some conditions such as fibromyalgia, which people may have heard about, and with that there is tender and trigger point and other symptoms as well. So if we change the screen now to me being the main one, Ray, if you can do that at some point, that's great, fab. Well, just a little bit of science, I just had to do this. And this is to tell you a little bit about what goes on between the nerve and the muscle. The nerve comes into a muscle at a neuromuscular junction and releases a neurotransmitter, which is called acetylcholine. And they think that at a trigger point, there is just too much acetylcholine in the junction, and it will then stimulate those receptors on the muscle side, which is called the motor end plate. And then that will cause contraction of the muscle, which is contraction of some filaments called actin and myosin inside the muscle, which interdigitate kind of like that. And so on contraction, they go between each other. So that's enough of the science. So now I'm just going to show you a little bit about treating them. in the clinic, we have a number of tools at hand to do this. First and foremost are my hands. So we use compression. So we use probably our thumb or maybe a reinforced finger, and we can use it on the thigh. So if I was going to do a trigger point in the quads here, I would put pressure with my thumb onto the trigger point. You hold that pressure for a minute, maybe up to 5. Really, when the pain goes, then you don't need to press anymore. In the clinic, we do have other things as well, because I think most of us use a lot of dry needling, it's called. It's a form of acupuncture, particularly to treat trigger points, so that we'll put an appropriate length needle into that. But obviously that's not available to us at home. I'll show you the other tools I use in the clinic, quite interesting. So here we have something called a T-bar with a rubber end. So we would hold the handle bit, obviously, and then find the trigger point, that sensitive, painful spot, and put pressure onto that and hold it for the appropriate time. I've got another one here, different made of plastic, and this has got an area here to do the same thing. And it also has areas on it which you can use for massaging the muscle, because after trigger point therapy, it is a good idea to either massage, a good massage strokes into the muscle, or to stretch it as well. And in fact, stretching can be used as a way of treating trigger points. It's where you spray first with a coolant spray over the muscle which has the trigger point and any areas of referred pain, and then you find that you can stretch the muscle much more easily afterwards. So what do we have in our homes that we can use instead of all those tools? So I think the classic one is probably a tennis ball or a golf ball. In our house, because we have a very playful dog, I've got these balls. I'm going to put them right up there so you can see. They've got this sort of plaited rope in them. I think we got them at Pets at Home in case anybody wants to go and buy them. But they really do a good job. And so the other thing I've also got here is where I've put a tennis ball in an old sock. And this means that you can use a wall to do the trigger point therapy. And I'll show you a bit more of that later. But first of all, I'm going to use these balls here to do trigger points in the gluteal muscles. So I might just need to alter this camera, I think. Yeah, I think you can see me there. Okay, so I'm going to take the bigger of these two and I'm going to put it on a potential trigger point spot here, which is just inside of where you feel that bony bit on the side of your thigh where it joins the bottom. Put it there, find the really tender spot, position it just exactly there, and then I'm going to straighten my leg like so, and you can move your foot until you find the exact spot, and then you can just stay there for however long it takes really for that pain to go, but we're really talking about a minute to 5 minutes. And when you've done that, then you can just move it, because the gluteal muscles are a big lot of muscles, and so there's probably another one, and do the same thing again. So now I'm going to move up to the lower back. So that's usually at the base of the spine. Same thing, straighten the leg and relax on it. Move it around. You think it's not quite on the spot. And again. So when you've finished doing your lower back, as we said, it's a good idea to massage muscles, and if you can't do that, then to stretch. So you've got your knee to chest stretch, just to stretch the muscle, because it will usually stretch more after you've treated the trigger point. So if we move on to the shoulders, then we can use probably the small one here. Move down a bit and put that underneath your shoulder, and that just gets the point there. You may be able, you don't have to put your arm up, but you can just do that. So again, it's the same thing. Stay with it over the trigger point for a minute or two. If the shoulders are tight in the pectoral muscles, which run across the front of your chest, then you can use one of these to stretch that. And I find putting it in the sort of hollow of the shoulder. So if you lie on your front, put it in the hollow of your shoulder, stretch your arm out, get that just right, give that a minute or two, and that will have taken the tenderness out of the pectoral muscles. You then go on to stretch those as well. And now I'm just going to show you, hopefully you'll be able to see this. I think you can, yeah. So I don't have much ball here, but I've got a little bit. So you hang the sock over here at the front here. So I could move that and just do another different point. And for those of you who want to do your gluteal muscles and can't lie down, find that too uncomfortable, then you can use a wall as well to do that. So just turn slightly at about an angle to the wall, put the pressure on, you've got your sock here, hold it in position, and again hold that there. So hopefully that's given you some food for thought at least, and if you can find an appropriate dog's toy or tennis ball, then you could have a go yourself. And hopefully it won't be that too long before we can actually see you again in the clinic and help you with all these problems. So I'm going to hand you back to Ray now, who's kindly been hosting us.
Thank you, Jenny. That was really good. I've had trigger point therapy from Martin Young many times, and I had no idea what it was supposed to be doing, but I'm going to have a go at doing it myself until I can get back to the clinic as well. Well, that's the end of our presentations today. We have had a few questions in the chat, and we've tried to answer the ones we've seen, but if some more come, or if you want to drop us an email, I will pass it on to the chiropractors. I will put up the email address. So it's clinic@chiro-cc.co.uk. But check out the website as well, because it is telling you what services we are able to offer during the pandemic. There may be something there that can help you. So then all I've got to say really is thank you so much for joining us. I hope we've been able to share something helpful for you today, and please keep well, keep safe, and as soon as the clinic is open, we'll be happy to all get together again. Thank you very much for your time.